What if one small pill could protect your heart, lower your blood pressure, and even help your kidneys at the same time? It may sound surprising, but this is exactly what a medicine called Ramipril is designed to do. Millions of people across the world take it every single day, and for many, it has become an important part of keeping their health on track. In today's video, we're going to talk about Ramipril in clear and simple terms. We'll look at what it is, how it actually works inside your body, and the most common side effects that you should be aware of. By the end, you'll have a better understanding of this medication and why doctors often prescribe it. Ramipril is a medication that doctors often prescribe for people with high blood pressure, heart problems, or to protect their kidneys. It belongs to a group of medicines that are trusted and widely used, especially for long-term health conditions. Doctors usually give Ramipril to people with high blood pressure, also called hypertension. By lowering blood pressure, it reduces the risk of serious health problems like stroke or heart attack. It is also prescribed for people who have heart failure, or for those who are recovering after a heart attack, to help the heart stay strong and avoid further damage. Another important reason Ramipril is prescribed is for kidney protection, particularly in people with diabetes. It helps reduce strain on the kidneys, lowering the risk of long-term kidney damage. How Ramipril works. Now that may sound a little technical, but in simple terms, these medicines work by helping your blood vessels relax. When your blood vessels are relaxed and open, blood can flow through them more easily. This means your heart doesn't need to pump as hard, and your blood pressure naturally comes down. Lowering blood pressure in this way is important because it reduces the strain on your heart. Over time, this can lower the risk of serious problems like heart attacks and strokes. For people who already have heart issues, Ramipril helps the heart work more smoothly and with less pressure. It also has a protective effect on the kidneys. By lowering the pressure inside the kidneys, it helps them function better and prevents long-term damage. This is especially helpful for people with diabetes, who often have a higher risk of kidney problems. Like all medicines, Ramipril can cause side effects, although not everyone will notice them. Understanding why they happen can make them easier to recognize and manage. 1. Dry cough. One of the most common side effects of Ramipril is a dry, tickly cough that doesn't go away. This happens because Ramipril increases a natural chemical called bradykinin, which can irritate the throat and airways. The cough is harmless but can be frustrating, especially at night. To manage it, try sipping warm water or herbal teas to soothe the throat. Honey in warm water or ginger tea may also help calm irritation. Avoid smoking and strong perfumes, as they can trigger coughing fits. If the cough continues and affects sleep or daily life, the only lasting solution is to speak to your doctor. They may suggest switching to another type of medicine called an ARB, or angiotensin II receptor blocker, such as losartan or valsartan. These work in a similar way to lower blood pressure, but usually do not cause cough. 2. Vomiting. Some people may feel sick or vomit after starting Ramipril. This happens because the medicine can affect the way your stomach and digestive system react, especially in the early weeks. Vomiting can also be linked to a sudden drop in blood pressure, which sometimes upsets the stomach. To help manage this, try eating smaller meals, avoiding rich or greasy foods, and drinking water in small sips to stay hydrated. If vomiting is frequent or severe, you should contact your doctor, as it can lead to dehydration. 3. Dizziness or lightheadedness. Dizziness often happens when you first start Ramipril or when the dose is raised. It occurs because the medicine relaxes blood vessels, lowering blood pressure. If blood pressure falls too quickly, the brain gets less blood flow for a short time, causing dizziness, especially when standing up suddenly. To reduce this, rise slowly from sitting or lying down. Drinking enough water is important, as dehydration can make dizziness worse. Eating smaller, balanced meals rather than large heavy ones can also help keep blood pressure steady. Avoid too much alcohol, as it can intensify dizziness. If the feeling doesn't improve or you faint, you should seek medical advice. 4. Tiredness. Some people feel more tired or sluggish after starting Ramipril. This is because the heart is working under less pressure and the blood pressure is lower, which can take time for the body to adjust. During this phase, you may feel as if you have less energy. To manage it, make sure you get enough rest and sleep, and try gentle exercise such as walking, which can improve energy over time. Eating habits also matter. Aim for balanced meals with whole grains, lean proteins, fruits, and vegetables to keep energy levels stable. Avoid skipping meals, as low blood sugar can add to tiredness. If fatigue remains for weeks or worsens, a doctor should check your dose or rule out other causes. 5. Diarrhea. Diarrhea is another possible side effect. Ramipril can sometimes irritate the digestive system, making food move more quickly through the gut. If this happens, it's important to drink plenty of fluids to replace what you've lost and to eat light meals such as bananas, rice, or toast until it settles. Avoid spicy or oily foods, as these can make diarrhea worse. If it carries on for more than a couple of days or becomes very severe, seek medical advice, as ongoing diarrhea can lead to dehydration and imbalance of salts in the body. When to seek medical advice. Most people take Ramipril without serious problems, but there are times to seek medical help. If the cough becomes severe or persistent, speak to your doctor. If dizziness makes daily life difficult or you feel faint and very weak, this also needs checking. Get urgent help if you notice swelling of the lips, face, or throat, as this rare reaction can be serious. And remember, never stop taking Ramipril suddenly on your own. Always speak with your doctor first. If you're taking Ramipril, staying informed will help you feel more confident and safer with your treatment. By knowing what the medicine does, the side effects to look out for, and when to seek advice, you can work with your doctor to protect your health and get the best results. If you found this video helpful, please give it a like. And don't forget to subscribe to the channel for more clear and simple health information.